thought carbohydrate loading was ridiculed with a lot of pseudoscience, brace yourself, because the sodium and water manipulation strategies commonly employed by bodybuilders are even more absurd and unscientifically founded. But before moving on to debunking some of these pseudoscientific protocols, it's important that you're familiar with the fluid compartments within the body and how fluid balance in the body is regulated. About 60% of the body is made up of fluid, which is composed of water, electrolytes, and other compounds. About 2/3 of the fluid is found inside the cells, called the intracellular fluid, and about 1/3 of the fluid is found outside the cells, called the extracellular fluid. The extracellular fluid can be further subdivided into interstitial fluid, which is the fluid between the cells and the plasma. The interstitial fluid helps bring oxygen and nutrient to the cells and remove waste products from them. The body of an average 70 kilogram male contains about 42 liters of fluid, which roughly consists of 28 liters of intracellular fluid and 14 liters of extracellular fluid. Of the 14 liters of extracellular fluid, approximately 3 liters is plasma fluid, the liquid part of the blood that carries the cells and proteins throughout the body, and 10.5 liters is interstitial fluid. There is also a small amount of transcellular fluid, which is a fluid contained within the epithelial-lined spaces such as the cerebrospinal fluid and the fluid of the eyes and joints. The general consensus is that on show day, you want to maximize the intracellular fluid and the plasma or intravascular fluid, which increases muscle fullness and vascularity, and minimize the interstitial fluid, which can obscure muscle definition. This is the whole purpose of sodium and water manipulation during peak week. Some well-respected figures in the industry, such as Dr. Layne Norton, have been quite vocal for many years now and warned competitors against using sodium and water manipulation strategies on peak week. That's because the ratio between the intracellular and extracellular fluid is tightly regulated within a narrow range in order to maintain osmotic equilibrium. If anything, it is much easier to tip the pendulum in favor of increasing the extracellular fluid and decreasing the intracellular fluid, since we normally store most of our fluid within the cells. The other thing is, people falsely assume that most of the interstitial fluid is contained beneath the skin where it obscures muscle definition. In reality, only a small amount of fluid is contained within, not beneath the skin. You may have seen some of those ads in the magazines or online selling diuretic supplements like the one shown here. Notice how they make a reference to the subcutaneous fluid layer located between the dermis and the epidermis. And when you take their product, that fluid disappears. However, if you open any physiology textbook, such as the one shown here, you will see that there's no such thing as a subcutaneous fluid layer. It simply doesn't exist. These supplement companies prey on ignorant or misinformed consumers by using these false advertising tactics to try and sell their products. In reality, the dermis and epidermis are connected, and there's no subcutaneous layer in between. The dermis is the thickest layer of the skin, which is made up of fibrous and elastic tissue and contains about 60 to 70% water. The thickness of the dermis is between 1 to 4 millimeters, depending on the area of the body where it is located. So, even if we could deplete some of the water from the dermis, we're talking about a 1 to 2 millimeter reduction in skin folds at best. You can see now why some coaches advise against this, especially given how easy it is to mess it up. If you simply maintained your normal water and sodium intake leading into a show, you would look 95% as good as if you depleted water from the skin. Furthermore, studies have shown that even moderate carbohydrate loading can marginally reduce skin fold thickness without any dehydration taking place. The reduction in skin folds might occur as a result of glycogenesis pulling fluid from the subcutaneous region. It's also possible that increasing muscle glycogen and intracellular water increases the pressure between the muscles and the skin, causing the skin to become tighter. This is similar to the way how muscles feel tighter when you get a pump in the gym. Lastly, it is also false to assume that the muscles contain only intracellular water. A good portion of the fluid in the muscles is contained within the extracellular compartment. So, even if you were able to reduce the extracellular fluid without affecting the intracellular compartment, you would still be sacrificing some muscle fullness. Therefore, the safest and most effective bet might just be not implementing any dehydration protocol at all. A moderate carbohydrate load without any dehydration will likely yield the best combination of fullness and dryness for most competitors, especially bodybuilders and physique competitors. However, some divisions such as women's fitness and bikini, coming in really full is not desired. Furthermore, some people naturally retain a little bit more fluid. Idiopathic oedema is a condition of mild fluid retention where the cause is not fully understood. It occurs in otherwise healthy individuals who do not have any kidney or heart conditions. It's not serious, but it can make someone appear less lean than they really are. Middle-aged women are most commonly affected. Women are also more prone to fluid retention around their menstrual cycle, and for some female competitors, the competition may fall right around that time of their menstrual cycle where they're retaining more fluid. Therefore, in some instances, it may be favorable to implement a mild dehydration protocol. You're going to learn a safe and effective strategy here that you can use to reduce some of the fluid from the dermal layer of the skin without impacting the intracellular compartment. This is important even for fitness and bikini competitors because if they dehydrate too much and they lose too much intracellular fluid, their muscles will look soft and flat. That's why simply reducing or eliminating water intake is not the solution. Now, in order to understand how you can do this effectively and what you must avoid, you need to have a good understanding of fluid dynamics and how fluid in the body is regulated. Fluid balance between the intracellular and extracellular space is driven by osmotic pressure. That means water will diffuse from an area of low solute concentration to an area of high solute concentration in order to maintain osmotic equilibrium. For example, if you deplete sodium from the extracellular fluid, you will retain less fluid in the extracellular space so that it remains in osmotic equilibrium with the intracellular space. Now, fluid movement between the plasma and interstitial fluid is driven by hydrostatic pressure, which is the pressure exerted by a fluid. Since hydrostatic pressure is proportional to the depth and density of a fluid, if plasma volume decreases, fluid from the interstitial space will leak into the plasma. Now, remember these principles as they will become important later. There are three main hormones that regulate fluid balance in the body, including antidiuretic hormone or ADH, aldosterone, and atrial natriuretic peptide or ANP. Antidiuretic hormone, also called vasopressin, is responsible for water reabsorption and constriction of blood vessels. It increases in response to hypovolemia due to dehydration, and it decreases in response to hypovolemia due to excess fluid intake and high blood pressure. Aldosterone is responsible for the absorption of sodium and excretion of potassium. It increases in response to low sodium or high potassium intake and decreases in response to excessive sodium or low potassium intake. Aldosterone levels are also increased by adrenocorticotropic hormone or ACTH and angiotensin II, both of which are activated by stress. That is why it's important to deload the week before a competition because stress increases sodium and extracellular fluid retention. Now, atrial natriuretic peptide literally opposes the action of antidiuretic hormone and aldosterone. It increases the excretion of sodium in water and causes vasodilation and increases vascular permeability. It increases in response to hypovolemia and hypertension and decreases in response to hypovolemia. Together, these hormones regulate fluid balance and blood pressure since blood pressure is very intimately tied to fluid volume. The reason you see competitors' sodium and water load during peak week is to suppress ADH and aldosterone and increase ANP. This puts the body in water flushing mode, so once sodium and water are restricted, it will flush them out. However, much like glycogen depletion, this is a futile endeavor because the flushing mode is lost very quickly once you flush out all the excess water. The half-life of antidiuretic hormone and aldosterone is only about 20 minutes, and atrial natriuretic peptide only about 2 minutes. That means after a couple of hours of restricting sodium and water, the flushing effect is lost. So at the end of the day, you can't outsmart your body. It is very well equipped to defend against excess sodium and water loss, not to mention extreme dehydration is very dangerous and completely undesirable because 7% of your muscles are made up of water, which you want to keep in there. If you were completely dehydrated, you would literally look like a mummy. Instead, the goal is to achieve only a mild level of dehydration from the extracellular fluid compartment. Extreme water restriction, as most competitors employ, will leave you flat as a pancake because there's substantially more water in your muscles than the skin. Most competitors falsely believe that once they've carved up, they will hold the water in their muscles because glycogen is stored with water and all the fluid they deplete will be from beneath the skin. In reality though, the muscles are made up of 70% water, of which glycogen only makes up a very small percentage. Glycogen only makes up about 1 to 2% of the volume of skeletal muscle cells. Therefore, cutting water is not the answer. There are actually 3 types of dehydration, including hypertonic dehydration, hypotonic, and isotonic dehydration. Hypertonic dehydration occurs when more water than sodium is lost, which typically occurs when competitors cut water completely, even if they cut sodium as well. The result is an increase in sodium concentration in the extracellular fluid, causing water to shift from the intracellular to the extracellular space in order to maintain osmotic balance. This was demonstrated in a well-designed study by Hiroshi et al., where a group of participants underwent 90 to 110 minutes of low-intensity aerobic exercise until their body weight decreased by 2 to 3% due to dehydration. Following that, the change in fluid from different compartments was measured for the next 60 minutes. Check the following graph adapted from the Hiroshi study. Initially, there was a large reduction in plasma volume, but because plasma volume is so critical for maintaining blood pressure, it was partially restored as fluid shifted from the interstitial space into the plasma. Remember, fluid movement between the plasma and interstitial space is driven by hydrostatic pressure. So when the pressure in the plasma decreases, fluid from the interstitial space will leak into the plasma. When interstitial fluid leaks into the plasma, it becomes more concentrated than intracellular fluid, causing water to diffuse from the intracellular to the interstitial fluid due to the osmotic gradient. The net result is a reduction in both fluid compartments. That is why cutting water will make you look flat. Even if you're a little drier, you will look a lot smaller and smoother because a hydrated muscle fiber looks full, hard and striated, while a dehydrated muscle fiber looks soft and flat. Here's an example of yours truly from one of my earlier contests following a traditional water depletion protocol. The 2 photographs were taken one day apart. The first photograph was taken the day of the contest following nearly 24 hours of water restriction. The second photo was taken a day later when normal drinking had been resumed. Notice how much fuller, harder and more striated the second photo looks. There was also a difference of about 2 kilograms between the 2 photos. That's a difference being properly hydrated can make. That's why you shouldn't cut your water intake. Even worse, most competitors don't just cut water, they cut sodium as well. But then the night before or in the morning of the show, they have a junk meal packed with sodium. This is erroneously based on the theory that acute sodium loading increases vasodilation. Now, while that may be true under normal conditions, after 24 to 48 hours of sodium restriction, aldosterone levels will be through the roof, which will cause you to retain the excess sodium. Now with all that excess sodium sitting outside the cells, water will diffuse from the intracellular to the extracellular fluid due to the osmotic gradient, which is exactly what you don't want. That is why you see so many competitors come out so flat and smooth on stage. Bear in mind, all this doesn't really matter as much for assistant competitors because they usually take pharmaceutical diuretics, which strips out all the excess sodium and extracellular water. Pharmaceutical diuretics tend to spare potassium and hence intracellular water, which makes assistant competitors more immune to these unscientifically founded tactics. As you can see, cutting water isn't the answer. Water follows solutes, so if you want to reduce fluid from the extracellular space, you need to reduce the concentration of solutes in the extracellular fluid. Now, hypotonic dehydration occurs when more sodium than water is lost. This typically occurs from excess sweating while consuming a hypotonic solution. Studies have shown that if salt losses from sweat are not replaced following exercise, there's a transfer of water from the extracellular to the intracellular space. Sweat is normally hypotonic, meaning that it has a lower concentration of solutes than the plasma. However, if water loss following sweat-induced dehydration is replenished, while sodium loss is not, the net effect is a greater loss of sodium than water. This will make the extracellular fluid more diluted than the intracellular fluid, hence water will diffuse from the extracellular fluid to the intracellular space due to the osmotic gradient. Now, while this sounds like the perfect scenario because you're redirecting the fluid from the extracellular to the intracellular space, which would create a fuller and drier look, you must be careful here. Hypotonic dehydration can cause hyponatremia, which is very dangerous and potentially life-threatening. It can cause the brain to swell and a cerebral edema may occur. Symptoms of hyponatremia include nausea and vomiting, headaches, confusion, loss of energy and fatigue, restlessness and irritability, muscle weaknesses, spasms or cramps, and even seizures or coma. However, if you're fairly sensible, the risk of that should be minimal. Hyponatremia is most likely to occur with extreme dehydration, which typically occurs in long-duration endurance events or when taking pharmaceutical diuretics. The protocol recommended here only induces a mild dehydration of 1 to 2% body weight. Light exercise in protective clothing generally causes water losses of 1 to 2.5 liters per hour. So for most people, 1 to 2% dehydration can be achieved with 60 to 90 minutes of moderate intensity exercise. Dehydration induced by a sauna can cause similar rates of water loss. Once a 1 to 2% level of dehydration is induced, which is typically done in the last 24 to 48 hours before a show using exercise, sauna, or a combination of both, competitors should aim to restore most of the fluid lost while minimizing their sodium intake until after the show. This should restore the fluid within the intracellular space but not the extracellular space due to the reduced sodium concentration. This is called isotonic dehydration, which is when water and sodium are lost in equal amount, leading to a reduction in the extracellular but not intracellular fluid. Most of the extracellular fluid loss should be from the interstitial space because the body tightly guards against sodium losses from the plasma since it's so intimately tied to blood pressure. Competitors should avoid loading potassium or drinking too much water during this time as that could increase the risk of hyponatremia. They should maintain their normal potassium intake and possibly reduce their water intake slightly by about a quarter. Now, based on everything we've discussed so far, there are 3 options that you can implement as far as sodium and water manipulation before a show. The first option is just to keep sodium and water intake normal all the way through. A moderate carbohydrate load, as discussed previously, will replenish glycogen stores and pull more water into the muscle cells. Since you naturally hold a lot more water in your muscles than the skin, this is a very safe bet. You also want to make sure that you're getting enough potassium, as many people are deficient in potassium. This can cause fluid from the intracellular space to diffuse into the extracellular space due to the concentration gradient. The second option would be to do a mild dehydration protocol the last 24 to 48 hours before a show, as discussed. You can break it up over 2 days with a 30 to 45 minute bout of exercise or sauna on each day, followed by near full replenishment of fluid but not sodium. This option would potentially reduce some of the fluid from the skin. However, it's likely that blood volume and some of the extracellular fluid from the muscles may also be reduced slightly, which can impact muscle fullness and vascularity. In essence, you'll be trading off dryness for fullness and vascularity. The third option would be to do an acute sodium load 2 hours before the show. As mentioned previously, acute sodium loading increases vasodilation, which can increase vascularity. Taking about 2 grams of sodium 2 hours before stepping on stage should do the trick. This option would be most suitable if you want to attain maximum vascularity. Note that if you choose option 3, make sure you do not mix it with option 2. That would have a disastrous effect because the body would retain all the excess sodium as aldosterone levels would be through the roof. Only do the acute sodium load if you have been maintaining your regular sodium and water intake up until that point. Now, which option you choose will largely depend on the client, their body type, and which category or federation they're entering. For example, if someone tends to be naturally quite dry but not very full, they may do better on the acute sodium loading protocol, especially if competing in a division where maximum vascularity is desirable. But for someone that naturally retains a bit more fluid, the mild dehydration protocol may be better. It wouldn't hurt to experiment with these protocols a few weeks beforehand to see what works best.